Cox's Bazar, Bangladesh, the home of the world's longest beach. It is one of the most famous tourist destinations in Bangladesh. But the area is also prone to natural disasters. Illiteracy and poverty are widespread. Bangladesh has a high infant and maternal mortality rate. Local governments are seriously strapped for resources and cannot completely address the basic health care needs of women and children. Hope Foundation of Bangladesh is a non-government organization set up to fill that void. The foundation manages the entire spectrum of healthcare, starting from fundraising to primary health care to acute trauma care. Pregnancy-related complications cause many deaths in our country. We have raised the awareness about this hospital in the community. Because of that, pregnant women are coming to us at an early stage. We are able to detect potential complications and take appropriate actions. The roots of Hope Foundation took shape halfway across the world in another location also famous for its sea resorts, in sunny South Florida. In the beginning, it was all but a tiny hope and a dream of a single person, Dr. Iftikhar Mahmood, a son of Bangladesh living and working in Miami, Florida. At the center of Hope Foundation's operation is Cox's Bazar Hospital for Women and Children. Established in 1999, it is a modern 40-bed hospital well prepared to look after the healthcare needs of the local population. The hospital is conveniently located near a busy highway where the local residents can easily access it. Upon arrival, patients are efficiently processed by a receptionist. A small fee of 40 taka, less than $1, is charged per visit. They are then seen by one of the doctors on outpatient duty that day. Inside, there is a gender-separated 40-bed inpatient ward. While most of the patients are women and children, the number of male patients has been slowly rising. The hospital is self-sufficient with its own radiology unit, 24-hour pathology lab, an ultrasound machine. This allows the hospital to provide timely and cost-effective services to its patients who otherwise cannot afford commercial services from the city hospitals. Infant mortality rate remains high in this country. The hospital is taking a serious stand against the problem through its childbirth, postnatal, and neonatal care services.
This baby was brought here with severe respiratory difficulty, and the temperature was 104. He couldn't eat anything. We put him on IV and gave him medicine. For 3 days he fought with death. His family almost gave up hope. Yesterday he started to improve, and today he's doing much better.
In April 2010, the hospital added a fully functional trauma care unit. Funds for the Operation Theater came from donations made by Bangladeshis living in the United States. This has been a true blessing for the local population. Patients needing trauma care do not have to be forwarded to the city hospitals, thereby saving critical time and cost. hospital keeps a large supply of drugs that it distributes completely free of cost. For other types of drugs, there is a pharmacy on site. The pharmacy stays open 24 hours a day and supplies common drugs at a discounted price. If the pharmacy wasn't there, patients would have to travel 8 kilometers to the city to buy medicine. Also, we offer a 5% discount on all drugs. The foundation operates 8 smaller clinics in far-flung areas. The clinic at the Maheshkhali Island is a good example of how the foundation is taking healthcare to remote and underserved areas. Without this clinic, the island population would be in a dire situation. Twice a month, medical camps are held at these clinics. These camps have proven to be effective in taking medical care closer to the people that need it most. A camp is widely publicized in the community. This brings a large crowd of patients who are promptly seen by a number of doctors attending the camp. A distinguished board of directors closely governs the operations and finance of Hope Foundation. Inspired by the mission set by Dr. Mahmood, members volunteer their time and expertise for the cause. The employees of Hope Foundation are dedicated and go beyond the call of duty, but they need your support to fully meet all the challenges. Of all obstacles facing the foundation, none are more serious than an acute shortage of doctors. Our biggest problem is a shortage of doctors. Sometimes patients come to the hospital only to see that there is no doctor. This damages the reputation of the organization. Now we are getting serious about solving the recruitment problem. Another problem we have is the ambulance service. The ambulance is really small. Although we have an oxygen cylinder and other facilities inside the ambulance, because of the space shortage, serious patients tend to avoid using it. The obstacles are enormous, but with your help and support, there can also be hope.
Remember all the faces of this dirty little war. Read into all the spaces. Everyone's running for the door. Change your mind. Won't hurt your pride. Change your mind. Don't let fools collide. Change your mind. Don't waste my time.